So now we are going to discuss the various diseases that occur due to the B cell disorder. So these are the various immunodeficiency that occur due to B cell disorder. Those are Xlink A gamma globinemia, which is also known as Bruton A gamma globinemia, selective IgA deficiency, or common variable immunodeficiency. These are the three diseases that occur due to the B cell disorder. Those are the immunodeficiencies that occur due to B cell disorders. Now let us discuss first about the Xlink A gamma globinemia. So in the Xlink A gamma globinemia, mainly there is the defect in the BTK, which is the tyrosine kinase gene, which leads to the no B cell maturation. So it is the Xlink recessive type. So it is mainly increased in the boys. So what happens is that tyrosine kinase is a gene that is required for the B cell maturation. So it is defective in the Xlink A gamma globinemia. So due to the defect in the tyrosine kinase gene, there will be the no maturation of the B cell. So it will eventually lead to the immunodeficiency and a condition known as the X gamma globinemia. So the presentation of this disease, Bruton A gamma globinemia, will be the recurrent bacterial and the enteroviral infection after the 6 month of age, because there will be the decrease in maternal immunoglobulin G. So initial 6 month of age, the immunoglobulin G that is acquired from the mother is working very well, but after the 6 month of age, there is gradual declining of the immunoglobulin G which is acquired from the mother. So after the 6 month of age, there is recurrent bacterial infection and enteroviral infection. The main findings in the disorder will be the absent B cell in the peripheral blood, decreased amount of immunoglobulin of the all classes. There will be the absent or scanty lymph node in the tonsil. The primary follicles and the germinal centers are mainly absent in the lymph node and the tonsil. In those type of the people who have Xlink A gamma globinemia, the live vaccinations are the contraindicated, because it is extremely dangerous to give the live vaccine because of their immunodeficiencies. Now let us discuss about the selective IgA deficiency. The cause for the selective IgA deficiency is still unknown, but it is the most common primary immunodeficiency. The presentation of this selective IgA deficiency is majority are asymptomatic, but we can see the airway and the GI infection in those people with selective IgA deficiency. There will be the autoimmune diseases, there will be the atopy and anaphylaxis to the IgA containing products. You can remember it by the 6A. They could be the asymptomatic, airway and GI infection, autoimmune disease, atopy, and anaphylaxis to IgA containing products. So what will be the findings in the people with the selective IgA deficiency, patient with the selective IgA deficiency? There will be the decrease of IgA with normal immunoglobulin G and immunoglobulin M levels. There will be the increased susceptibility to giardiasis, which can cause the false positive beta HCG test. So these are the various findings we see in the selective IgA deficiency. Now let us talk about the common variable immunodeficiency. In the common variable immunodeficiency, there is the defect in the B cell differentiation. So the cause is unknown in the most of the cases. The presentation in the common variable immunodeficiency, it may present in the childhood but usually diagnosed after the puberty. So there is increased risk of the autoimmune disease, bronchiectasis, lymphoma and sinopulmonary infection. The findings in those patients with the common variable deficiency will be the decreased amount of the plasma cells and decreased immunoglobulin in the blood. So these are the various findings in the common variable immunodeficiency. So we talk about the various B cell disorder that leads to the immunodeficiency. Those are Xlink A gamma globinemia, selective IgA deficiency and common variable immunodeficiency. We talked about their defect, how they occur and their presentation and their findings. I hope you understood this topic on the B cell disorder immunodeficiencies. Thank you.